What makes a relapsing MS treatment effective? A wise doctor once said that treating multiple sclerosis is a marathon, not a sprint.
But why? I don't always like to take my time. I'd rather just get there.
That's probably the best way to approach relapsing MS treatment. MS is a lifelong chronic condition and as such requires a well-thought-out treatment plan. This is why it's important to select a treatment option that's right for you.
But how do I determine which direction or treatment to choose?
You can start by understanding why you're taking your treatment. An effective relapsing MS treatment, or disease-modifying drug, DMD for short, can potentially treat relapsing MS in 3 important ways. Doctors call them treatment measures. Before I outline these measures, though, you should know that not all DMDs work for every person. It's a good idea to talk to your doctor about the DMD that's right for you.
Got it. So, how can DMDs help treat relapsing MS?
First, DMDs may reduce the frequency of relapses.
What's relapse?
A relapse, also called an attack, exacerbation, or episode, is an event lasting more than 24 hours when old symptoms worsen or new ones appear. During a relapse, your doctor might notice a change in your reflexes, coordination, strength, or eyesight. The relapse rate is the number of relapses a person experiences. This chart shows the relapses and remissions in relapsing MS.
That makes sense. So, what's the second way that DMDs can help treat relapsing MS?
Second, DMDs may reduce the buildup of lesions or damaged disease areas within the brain and spinal cord as seen on MRI.
What does that mean?
An MRI shows the amount of water in tissues in the brain and spinal cord. Lesions in MS have higher than normal water content. What your doctor sees on an MRI scan doesn't necessarily predict what he or she might find during a clinical exam. There isn't an exact correlation. But an MRI scan does give your doctor a snapshot of what's going on inside the brain. And over time, it can be helpful to compare snapshots to see if changes are occurring. Here, you can see lesions caused by MS disease activity.
I see. That sounds helpful. And the third way?
Third, certain DMDs may slow the accumulation of disability.
That's what I want. A DMD that does that.
There is a self-injected therapy option proven to achieve all 3 treatment measures, Rebif interferon beta-1a. Indication: Rebif is used to treat relapsing forms of MS to decrease the frequency of relapses and delay the occurrence of some of the physical disability that is common in people with MS. Rebif is not approved for treatment of chronic progressive MS. Please stay tuned for important safety information and see the Rebif prescribing information and medication guide located in the top right corner of this video player window.
And this was proven, you say?
Yes. This was shown in a large placebo-controlled study of interferon therapy for relapsing MS. The 2-year PRISM study included 560 people to see how they responded to Rebif 22 micrograms or Rebif 44 micrograms versus placebo, all given under the skin 3 times a week. Important safety information. What are the possible side effects of Rebif? Flu-like symptoms, fever, chills, sweating, muscle aches and tiredness, skin reactions, soreness, redness, pain, bruising or swelling may occur at the place of injection.
So, now that I know all of this, what's my next step?
You can start by talking to your doctor about these key treatment measures and the DMD that's right for you. It's also important to read a drug's medication guide and prescribing information located in the top right corner of this video player window, and review important safety information.